Hi, my name's Kimberly George, and I'm the co-host of Outfront Ideas with Kimberly and Mark. Outfront Ideas is an educational and thought leadership platform focused on supporting the workers' compensation and insurance industry.
Hi, I'm Mark Walls. Today we're joined by the winners of the 2023 National Underwriter Excellence in Workers' Compensation Risk Management Awards. These annual awards honor the best workers' compensation programs in the country. You can find the complete stories of these in the latest edition of National Underwriter Property and Casualty. Let's start by meeting the winners. Randy, introduce yourself.
Hi, I'm Randy Jobin, Chief Risk Management Division, County of Fairfax, Virginia.
Brian?
I'm Brian Connor. I oversee the work comp program for American Airlines.
Sharon?
Hi, I'm Sharon Dressel, the risk manager for the City of Beverly Hills.
All right, Sharon, let's start with you. The article talked about your efforts to expand mental health services to your workforce during the pandemic. Tell us how you approached that.
We decided to reach out to our partners, those that had the greatest amount of expertise in mental health and wellness, and engaged in some of the programs that they offered. And those partners included our third-party administrator, Corvell, for work comp, our employee assistance program. We have an on-site program, and we also have a traditional EAP, and then also our partnership with Kaiser on the job.
The article also talked about your efforts to expand employee engagement with your program. How did you do that?
We have an ongoing effort to try to engage our employees in a number of different ways. We do a lot of communication. We engage with department liaisons, and we do a lot of training for supervisors and managers, and offer employee wellness and incentive programs to engage them in things that aren't always work related, but help engage in enhance work for them.
Thank you.
All right, Brian.
Yes, Kimberly.
The article about American Airlines discussed your risk management philosophy and advocacy. Will you tell us a little bit more about the advocacy program at American Airlines?
Yes, ma'am, Kimberly. The biggest thing I'd like to just get across is caring for injured team members on the journey of workers' compensation. That's really the focus. Care for the injured team members on the front line. That front time, as soon as they're injured, right up until their return to work, and really understanding and making sure the team member has an approach, a resource every single time or any time in the program.
And what role do the claims adjusters have in that, Brian?
Well, as we all know, the claims examiners are the secret sauce to the claim. They're the quarterback, as well as I believe deeply in my heart that the claims examiners really set the tone for the entire claim, and also provide an advocacy for our injured team members. Because if the claims examiner is being supported fully by an employer, that customer service level and that advocacy approach reaches down right to the claims examiner, so that they can also too care for the injured team member on the journey of workers' comp. So it starts with the examiner and really learning to love on our injured team members. That is so important.
Wonderful. Back to Mark.
All right, Randy, let's turn to you now. You've undertaken a number of changes to your workers' compensation program to improve your results. Tell us briefly about those things that you did.
Thank you, Mark. The first two steps was around the medical management of the claim. First thing we did is we kind of look at our police, fire, and our public safety individuals as tactical athletes. So we needed providers who looked at them in the same manner. Do not treat them as people sitting at a desk. They're out there. So we looked at athletes. So we looked at our panels, and we wanted to get medical providers that wanted to return them back to work, and started work readiness right in line with getting the physical therapy for the injuries. Another important aspect of that is we actually embedded a physical therapist right on campus with the fire and police right in the public safety headquarters. This way they had an individual they could go in, they could see, and we worked it right around the entire program, and we made them part of the process, where normally in the past the medical providers are kind of distanced from the program. The next thing we looked at with the help of Corvell, or TPA, is we looked at the medical aspect of the claim. If you have an athlete and they're out of a game for 2 to 3 weeks, they start worrying, am I ever going back to the game? That kind of sets into their time frame in their mind whether or not they're going to be ready to get back in? Are they starting to get depressed? Are they starting to look at these other factors? So our mental health screening started looking at these factors to keep them encouraged and motivated and to return to work. And our final aspect was medication management. I'm sure we all heard about the opioid crisis and everything else. We were looking at very high opioid scores with a lot of our individuals. And even if they could return to work, they couldn't because of the opiates they were on. So we kind of took that entire program. It served in the communication with the adjuster, the doctor, the pharmacy, and risk management were all part of the same process. And we had substantial drop in our overall use of opioids and our opioid scores.
Well, finally, how has improved communication with your workforce changed the way they view your workers' comp program?
Communication is a constant and continual process, and I find that no matter what we do in risk management, your one data boy is, well, you know what that one data boy usually is the next day, I wouldn't say it. But it's a constant process, and what we tried to do is we tried to engage them that the adjuster, the doctor, the medical management, risk management, the employer were all part of the process. And at times when this communication broke down, we can't just assume it's the injured worker not knowing what's going on. It's our job as the professionals to talk to them, to educate them, and constantly go back to them, and not only ask them how is everything going with their case, but what's going on, and continuing that back and forth communication. So when there is a problem, hopefully they're coming to us before it becomes a crisis.
Thank you. Kimberly?
Thank you.
Well, what an amazing story you all have to share with our audience today. If there's one takeaway I have, it's that injured workers matter most to workers' compensation. Being able to support them on their journey back to health and productivity, keeping them engaged in their health, looking for quality, timely medical providers, and finally, understanding that mental health and well-being matter significantly in recovery. We'd like to thank National Underwriters, Property Casualty Magazine for creating these awards, to WCI for allowing the facilitation of the awards here at their conference, and to Safety National and Cedric for being the sponsors of this wonderful risk management recognition. And congratulations to each of the honorees.